Well, I was about 30 years old, and I was an antitrust associate at Jones Day in Cleveland. And I got a phone call from someone who helped to get Ed Koch, the mayor of New York back in the 70s, elected. And he said they were trying to recruit some new blood into the city. And he asked me if I'd be willing to come out and interview for a couple of jobs. And I said sure, since I was from back east. I had spent 4 years in Cleveland. They were good training years to be a law firm lawyer, but I was itching to do something else, and went east and interviewed several job openings with the Koch administration, and the one that seemed the most intriguing was the director of the Medicaid program. And I ended up getting offered that job, and so I found myself as a 30-year-old antitrust lawyer suddenly becoming a Medicaid administrator with about 500 people under me. During that time, I learned that what I really liked about government or managing people was the legal aspects, and so that's what convinced me that I did really want to be a lawyer, but that healthcare was a fascinating industry. And so that's how I got my start.
And then you went to work for Jones Day, I believe. Is that right?
Yeah, well, what happened is Jones Day gave me a leave of absence to work in New York City government. And they, at the end of a close to 2-year leave of absence, they asked me to return to the Washington office. And I happily did so with the hope that I could help develop a healthcare practice. But this was in the late 70s, and the notion of a healthcare practice at a Fortune 500 law firm really was a bit foreign. And so they gave it a try for a little while, and then basically said, you know, we just don't see the field growing in a way that works for us. And so I began to explore other opportunities, and ended up talking to David Greenberg. In my decision to look outside the firm, people began to recommend talking to David Greenberg, who had started something called the National Health Lawyers Association at that time. And I remember meeting in David's apartment. As I recall, his apartment was the headquarters of the National Health Lawyers Association. This was back in the late 70s. And he was so welcoming. Gave me lots of advice, gave me lots of contacts, and said, you know, if you really want to be a healthcare lawyer, you need to join the organization, and I can introduce you to a lot of people that will help your career. And he did just that, and that's what got me involved in health lawyers.
So tell us about your personal journey in healthcare law.
Well, aside from getting the start or the bug for in the healthcare industry in New York City government, I did a few things when I came back to Jones Day. Represented a psychiatry organization, but it wasn't all that fulfilling, which is why I really wanted to get into the industry. So once I came back to Jones Day in Washington, and after having met David, I began exploring in detail the possibility of joining either a provider organization or a health plan, and decided to go with an organization called Greater Southeast Community Hospital System, and met with the CEO, and he said to me, you know, I don't really need a lawyer, but you can be my chief of staff. And once I teach you the ropes on how to deal with healthcare CEOs, then you'll get hired away. And literally 2 years to the month that I was hired to work at Greater Southeast, I was hired away to become general counsel of what was then, and I think still is, the biggest health system in the DC area, now known as MedStar Health. And I stayed there for 17 years through a lot of changes. We started out as a 2-hospital system and grew to a 4-hospital system, and then acquired and merged with a hospital system in Baltimore and grew into 8-hospital system. And then back in 2002, I got lured away to come up here to Partners. And here I am, after 15 years, just about ready to retire. And it's been a great journey.
I would imagine, as an African American, you have had a lot of breakthroughs. You've been the first in a lot of places, a lot of categories. Can you tell us a little bit about that?
Well, actually, it started. I was not just the first African American. Started in college. I was not just the first African American, but the first young alumni trustee at Princeton. In 1969, after there were a lot of student protests, the board decided that it wanted to have a student voice on the board. And for my graduating year, they decided to elect a graduating senior. And that is still the case today. Every year, a graduating senior gets elected to the board. In '69, I was the first graduating senior to be elected. So that's a first, not in healthcare, but I was also the first African-American president of the National Health Lawyers Association, now the American Health Lawyers Association, and that was back in the mid-90s. Certainly in terms of a health law career, for an organization that was then, about 20, a little less than 20 years old. And for me, who had by then really committed to having a career in healthcare, it really was a way of catapulting me to some level of visibility, and it's worked quite well.
So what did it mean to you? What did it mean to your sensibility and that kind of thing?
Well, I think what it really meant was a validation of people recognizing that I was a healthcare lawyer, and back then it wasn't necessarily symbolic to be the first African American, but it was symbolic, I think, to me to have come through the ranks the way I came through the ranks, having been a healthcare lawyer, at about 15, having made the switch to become a healthcare lawyer about 15 years before, and recognizing that I really did have something to contribute.
How would you describe the challenges and the opportunities during that time for the American Health Lawyers Association?
Well, back then, we had grown. I think we were just under 10,000, and every year each new president was tasked with the goal of growing the membership. But we didn't have a lot of the technology advantages that the organization has now. We would have seminars that were all in-person seminars, and so in order to mount those seminars, it took a lot of resources. We didn't have, and back then again, there were a handful of law firms that had committed to healthcare, but not in as widespread a way that law firms have now. And certainly the number of in-house lawyers was very small. I think in terms of breakthroughs, while there had been other in-house counsel at American Health Lawyers, before the late 90s and early 2000s, National Health Lawyers had been primarily an association of private counsel, and the American Academy was primarily the in-house lawyers. And so for me to be an in-house counsel, but to become president of the National Health Lawyers, I think sent a signal that began to start the notion of maybe if we were able to combine these organizations, it could really be a powerful force. That happened several years after my presidency, but it was nice to see the beginning of those ideas take hold.
What would you say was the biggest accomplishment during your presidency?
I can tell you that there were a couple of things that were just getting off the ground when I did become president, and that was the public interest forums that began a couple of years before. They had convened, I think, the second one under my presidency, and that was significant. But I got to be honest, I really can't think of any one big accomplishment that happened in the 1 year that I was president. It was more of a transition.
How would you describe the culture of the National Health Lawyers Association and now the AHLA? How would you describe the culture?
Well, I think they were always, NHLA and now AHLA was always dedicated to trying to figure out where healthcare was going. What I liked about the philosophy was that it was really a partnership of private counsel, in-house counsel, and government counsel, because we always thought that given the fact that healthcare is so heavily regulated, it was going to always be important to include government counsel in our deliberations. And so the board had a good mix of all three, and whenever we had programs, we wanted to make sure that we had government input.
What about the notion of collegiality? I understand, reading some of the audio interviews that sometimes people who would normally be competing were sharing ideas and talking about issues they were facing.
Oh yeah, yeah. I think that was somewhat unique to the NHLA in the sense that these are all private practitioners, and the field itself, the client base, was not all that large, so the competition for clients was pretty heavy. But when it came time to sitting down in the association, it was really all about how do we best advance the education of our fellow lawyers in a way that makes us all better. And the collaboration that went around, the seminars that we put on, some of the public interest programs that we put together truly did reflect that collaboration.
A sense of inclusiveness as well?
Yes, no question about that. Inclusiveness not only based on where you came from in terms of law firm versus in-house, but also a sense that in order to be a real force, we needed to be a more diverse organization.
Healthcare law has seen dramatic change as it has evolved over the years during your career. What have been the most important milestones in your view?
Well, I remember way back when Medicare first came out with some of this was in the 70s, late 70s, some of their early rules. There was a payment rule that came out, and that was the first kind of reimbursement rule that really began to remind folks that it was important for the industry itself to be more proactive in a focus on patient quality and care and curing disease as opposed to simply billing for procedures. The second thing I think was HIPAA, the Privacy Act. That was a legislative act that gave us some real concerns about how to go about protecting privacy. Those concerns still linger today, particularly as privacy becomes much more related to data security. And in some ways, I would think the HIPAA rules tend to still be a challenge for all of us lawyers. I guess the third thing was really the whole notion of, particularly here in Massachusetts, the whole notion of movement toward managed care. Obviously, the Affordable Care Act that was enacted 7 years ago to the day, actually, Obamacare was a development that came out of Romney Care here in Massachusetts 3 or 4 years earlier. So having been here for the development of Romney Care really had the most significant impact on my career because it really did shape the way that we here in Massachusetts organize our healthcare.
That's interesting. So where do you see this going now?
That's a tough one to judge. I'm frankly saddened by the notion that there are some folks that want to repeal and replace the Affordable Care Act. I think the Affordable Care Act has a lot of very forward-thinking and important aspects to it, particularly in terms of expanding coverage, but equally as important in terms of making sure that we as providers are being held accountable for the kind of quality that we provide, keeping people out of hospitals rather than continuing to bill on a per procedure basis. So my hope is that with that Obamacare or the Affordable Care Act does survive in some form.
How has the American Health Law Association, Lawyers Association, what has that organization's role been in these changes? How have they responded or been involved in those changes, would you say?
Well, because of our philosophy, as I said, with always including government attorneys and getting input not just from attorneys but also from some of the leaders of the government healthcare organizations, there was always, in our view, a two-way street in terms of sharing information and sharing ideas. The AHLA would from time to time be sought after by CMS and by HHS to give input. And having been able to give that input has meant that when some of the rules were proposed to be changed, our views would be sought, or the views of some of our members would be sought, to test out how practical those changes might be in terms of real application.
I know HHS, I'm not sure about CMS. What is that, CMS?
CMS, it's actually the Center for Medicaid and Medicare Services. It's literally CMMS, but it's shortened to be CMS.
You're someone who's known as someone who sets an example, likes to get out and give back to the community. Tell me about that philosophy, why that's important to you, and some of the things you've done.
Well, I think it's important to give back both to the local community where one lives, but also to the professional community. And on the professional side, for me, that began pretty early on. When I first got into law practice at Jones Day in Cleveland, I was asked to help develop what was back then the first public defender program in Cuyahoga County. I think its origins really sit with my dad, who was the local NAACP leader in my hometown. He had me on a picket line when I was 10 years old protesting fair housing. That led to going to college in the 60s and protesting things at my university. And so I've always had a sense of, people who are able to have privileged opportunities like myself have an obligation to make life better for others. And so I've continued that, tried to continue that just in my own professional career, both as a lawyer, joining organizations that allow lawyers to give back and have an impact on the community, but also as a non-lawyer, just giving back to organizations that have helped me. For example, my service on the board at Princeton continues. I'm also here involved in the arts community, the Boston Symphony board as well, but also equal justice. I'm a member of something called the Massachusetts Equal Justice Fund, because I'm a firm believer that there has to be access at all levels to the courts, not just criminal access.
As a general counsel for one of the most prestigious hospital systems in America, how would you describe your perspective on what's happening with healthcare in America?
Well, healthcare continues to be a challenge, and it continues to be a challenge because of the varying ways, frankly, in which it's being funded. And a lot of that's historical, but in my view, it would make a lot more sense for us to look at healthcare the way a lot of countries look at healthcare, and that is thinking about becoming a single-payer system. We flirted with that, frankly, with the ACA. That didn't pass, and I'm expressing my own personal philosophy. I don't think it's ever going to happen, but one of the reasons that I support the continuance of the Affordable Care Act is because it does begin to start putting organizations like my own here at Partners into the mindset of making sure that people get well and stay well and get their health care managed so that they don't have to be hospitalized. And if we can get paid for keeping people out of the hospital, healthcare costs across the board will go down.
What's your advice for young attorneys considering a future in healthcare law?
Couple of pieces of advice. Number one, I think you need to be open to new challenges, to be open to serendipity is what I say. I go back to when I was at Jones Day and got the phone call from the people in the mayor's office in New York. I didn't really have any plans to come back east or to leave the firm, but when new ideas come and get put in front of you, you shouldn't be afraid to embrace what's the unknown. Also, when you're making career decisions, I think it's important to make them in a way that continues to optimize your options or maximize your options. And what I'm saying with that is if you're offered an opportunity, look beyond that opportunity to say, okay, where is it that if I take this opportunity, where will it lead me? Will it open doors beyond what I'm doing, or will it close doors? And my advice is always to take the opportunity that leads to more open doors.
And I read where you believe in taking a risk.
Yes. A risk both personally and professionally. I think the New York opportunity is what I was talking about, But I also have to say that personally, I've just been really blessed with having a life partner that that shares the same values that I do. And she was a pharmacist. My wife was a pharmacist who later in life decided to go to law school, and she took a risk by just switching careers. When she graduated from law school, she went to work at the FDA. But then 9 years out of the FDA, she was recruited by Johnson & Johnson. So we had to make a choice because I was still general counseling at MedStar in Washington, and she had to decide whether she wanted to move to New Jersey to work for Johnson & Johnson. So we had a commuter marriage for, much of the next decade. And that was a personal risk that I think, as we both look back on it, ended up rewarding both of us, because I think both of us have much more fulfilled careers as a result of taking that risk.
On this 50th anniversary, how would you describe the key milestones and contributions, accomplishments of the American Health Lawyers Association?
Well, first of all, I think they are the single, back then, they were the single most influential educational resource for healthcare lawyers. Clearly, now that they're combined, National Health Lawyers has combined with the American Health Lawyers, it's become even much more significant. Other organizations like the ABA have tried to, I guess, follow in our wake, so to speak, and I don't think they've really succeeded as effectively as the now combined American Health Lawyers has, because whenever I look to see, look at a list of who's who in healthcare, they more likely than not have been speakers or board members or program chairs of AHLA programs. And so I'd like to think that because of that philosophy of combining private practitioners with in-house practitioners with government practitioners, we're able to bring lots of different perspectives on not just the current healthcare situation, but where healthcare is going. And so I'm very optimistic that AHLA will continue to be, a leading force in not just healthcare education, but also healthcare policy going forward.
Finally, what are your keys to your success? How have you managed to accomplish all that you've done in your career, which has been spectacular?
I think a lot of it has to do with being a good listener, frankly, and trying to be as good a communicator as I can. I think back on that first interview that I had with the CEO, who said, I don't need another lawyer, but I do want to teach you how to communicate with healthcare CEOs, because coming out of a law firm, you're really taught to write like a lawyer, but to be a general counsel, frankly, you have to be able to write in ways that communicate with business folks, to break things down in very simple terms. And so communication is really key, both verbal and written. But it all starts with, frankly, being a good listener, because if you don't understand what your client wants or needs, you can't get them there.